Hello everyone, this is the Earth Archives. Many modern people have cardiovascular diseases. Many people know that it is due to excessive sugar intake. But in the last century, due to corporate conspiracy and the conspiracy of scientists, the problem was blamed on fat. Let's learn about it today. Before the show starts, please help subscribe, like and turn on the little bell. This will help the Earth Archives grow. The show starts. The debate over whether sugar or fat is the primary culprit behind heart disease has garnered significant attention in recent years. In 2016, researchers at the University of California, San Francisco, UCSF, uncovered long-buried documents revealing that sugar companies had bribed nutritionists at Harvard University in the mid-1960s. The goal was clear: to produce a review that would downplay the relationship between sugar and coronary heart disease, CHD. This revelation sent shockwaves through the medical and public health communities. It called into question decades of dietary recommendations and research, suggesting a conspiracy between respected scientists and the food industry to obscure the dangers of sugar while shifting the blame to fats. The historical context is crucial to understanding this narrative. In the 1950s and 60s, two primary schools of thought emerged regarding dietary impacts on heart disease. One side, championed by Ancel Keys, posited that dietary fat was the main risk factor for CHD, advocating for low-fat diets. The opposing view, represented by John Yudkin, contended that sugar was the true villain, but his theories were gradually sidelined, leading to his obscurity. In the years following these events, numerous studies and public health guidelines emphasized low-fat diets while largely ignoring the potential harms of sugar. As a result, many individuals unknowingly consumed high-sugar, low-fat foods, contributing to rising obesity and diabetes rates. This article aims to provide an exhaustive examination of the historical interplay between dietary recommendations, scientific research, and corporate interests, exploring how the legacy of this debate continues to influence public health policies today. The roots of nutritional science. Nutritional concerns in the post-war era. The origins of modern nutritional science in the United States can be traced back to the World War II era. Health officials recognized that deficiencies in nutrition could threaten economic productivity and military effectiveness. In 1941, the Rockefeller Foundation granted Harvard University $100,000, equivalent to approximately $1.6 million today, to establish a nutrition unit. Additionally, they provided nearly $1 million, around $16 million today, to 15 food companies to create the Nutrition Foundation, which aimed to support relevant research. Central to these efforts was Frederick J. Stair, a physician and biochemist appointed to lead the new department at Harvard and serve as the editor of the Nutrition Foundation's publication. Stair's vision for nutritional research focused on improving public health through better dietary practices and increased food consumption. As the years progressed, Stair shifted attention toward cardiovascular diseases, which accounted for a staggering 40% of deaths in the US by the mid-1950s. Recognizing the link between diet and heart health, he began to explore issues related to obesity and heart disease in the context of America's affluent eating habits. By 1951, Stair had secured sponsorship from 27 organizations, including the U.S. Public Health Service and various food industry groups, signifying the growing partnership between nutrition science and the food industry. This collaboration was not without controversy, as some questioned the potential conflicts of interest arising from financial support from food manufacturers. The rise of the low-fat paradigm. Initially, Harvard's nutritionists were inclined to support the notion that dietary fats were the primary risk factors for heart disease, largely influenced by Ancel Keys. Keys argued that the prevention of heart disease should begin with a low-fat diet, a stance that threatened the American diet heavily reliant on meat and dairy products. Over the next few years, Harvard researchers developed the idea that heart disease stemmed from the accumulation of lipids in the coronary arteries. This perspective was reinforced by observations of higher cholesterol levels among heart disease patients and data suggesting that lower animal fat consumption in Europe correlated with lower rates of coronary heart disease. In the 1950s, Harvard's nutritionists became involved in numerous collaborative research projects studying blood lipid levels among workers in various industries and examining dietary patterns in populations across different countries. The findings from these studies, combined with data from large cohort studies like the Framingham Heart Study, further solidified the low-fat hypothesis. By the late 1950s, the low-fat perspective had gained traction, especially after President Eisenhower's heart attack in 1955. Media outlets sought expert advice on healthy eating, and many nutritionists began promoting low-fat diets. Stehr himself contributed to this narrative, emphasizing the need for dietary changes to prevent heart disease. The sugar hypothesis. John Yudkin and the challenge to dietary fat. Amidst the rising consensus on the dangers of fat, John Yudkin, a British nutritionist, emerged as a prominent critic of the low-fat paradigm. Educated in medicine and biochemistry, Yudkin had initially struggled to secure funding for his research and ultimately turned to the food industry for support. Yudkin's foray into the diet-heart debate began with a 1957 paper questioning the prevailing assumption that high-fat diets led to higher rates of coronary mortality. He proposed that various factors, including sugar, animal protein, and lifestyle changes, could contribute to heart disease. In his research, Yudkin discovered a correlation between high sugar consumption and increased heart disease rates among immigrant populations transitioning from traditional diets to high-sugar diets. This led him to hypothesize that sugar intake could be a significant risk factor for heart disease, even more so than dietary fat. In 1964, he conducted a case-control study that assessed sugar intake among heart disease patients compared to healthy individuals. The results suggested a link between high sugar consumption and heart disease, prompting Yudkin to publish his findings in The Lancet. However, Yudkin's claims were met with skepticism. Critics pointed out flaws in his methodology, questioning his control for confounding variables such as smoking and body weight. Despite these criticisms, Yudkin's ideas gained traction, particularly among publishers interested in the growing discourse around diet and health. Industry influence and research bias. As the dietary debate unfolded, industry sponsorship of research became increasingly common. In 1962, Stehr's team, led by researcher Mark Hegsted, conducted a study examining the relationship between dietary components and blood cholesterol levels. Funded by a newly formed dairy industry foundation, this research aimed to explore the impacts of various dietary fats and carbohydrates on cholesterol. Hegsted's work had already earned him a reputation for producing data-driven analyses, and his findings would later play a pivotal role in shaping dietary guidelines. In a meeting in 1965, Hegsted discussed his study results, casting doubt on Yudkin's sugar hypothesis while emphasizing the evidence supporting the dangers of saturated fat. Following this, the Sugar Research Foundation, SRF, approached Hegsted to write a review paper downplaying the association between sugar and heart disease. Hegsted agreed to highlight sugar's limited metabolic impact while advocating for a focus on dietary fat in public health discussions. This review, funded by the SRF, was published in the New England Journal of Medicine in 1967, further entrenching the low-fat narrative in medical and public health circles. The Sugar Conspiracy, Myths and Realities. The unfolding of a sugar conspiracy. The narrative of a sugar conspiracy gained momentum in the 21st century, particularly following UCSF's revelations about the financial connections between sugar companies and prominent nutrition scientists. Critics posited that the industry had systematically suppressed unfavorable research, allowing sugar to evade scrutiny while shifting blame onto fats. While it's undeniable that corporate interests influence nutritional research, some scholars argue that the story is more complex than simple collusion. Researchers from Columbia University and New York University have suggested that the criticisms of the sugar industry often lack historical context. They assert that the actions of individual scientists and the broader public health policies of the time must be viewed through a nuanced lens. Evaluating the evidence. The notion that sugar is the sole villain in the heart disease narrative is overly simplistic. Scientific inquiry is inherently complex, and establishing definitive causality between dietary components and health outcomes requires rigorous, multifaceted research. Yudkin's attempts to challenge the prevailing low-fat paradigm were met with significant resistance. Despite his convictions, his studies lacked the robust evidence needed to sway the scientific community, which continued to support the low-fat narrative, backed by a larger body of research. Moreover, the evolution of dietary recommendations is not merely the result of corporate influence, but rather a reflection of the scientific discourse and prevailing attitudes toward nutrition over time. The increasing rates of obesity and diabetes in the United States over the last few decades have prompted a re-evaluation of dietary guidelines and the role of sugar in public health. The legacy of the debate: impacts on public health. The evolution of dietary guidelines. The public health landscape has been shaped by decades of debate over dietary recommendations. The U.S. government, responding to rising health concerns, formally adopted a low-fat dietary approach in the 1977 Dietary Goals for the United States. This marked a significant shift in nutritional guidance, emphasizing the need to reduce saturated fat intake while largely downplaying the potential dangers of sugar. In subsequent years, the American Heart Association, AHA, and other health organizations reinforced the focus on low-fat diets, promoting the idea that replacing saturated fats with carbohydrates could mitigate heart disease risks. However, this guidance led to unintended consequences as consumers increasingly turned to low-fat, high-sugar alternatives, contributing to rising obesity and diabetes rates. Recent years have seen a growing acknowledgement of sugar's role in heart disease. The World Health Organization, WHO, and American Heart Association have begun to highlight the risks associated with excessive sugar intake, advocating for lower consumption levels in dietary guidelines. Revisiting the debate today, as researchers continue to examine the long-standing debate between sugar and fat, the conversation around dietary recommendations has shifted toward a more holistic understanding of nutrition. The focus is now on the quality of foods consumed rather than merely reducing fat or sugar intake. Emerging studies suggest that the relationship between diet and health is influenced by a multitude of factors, including overall dietary patterns, lifestyle choices, and genetics. The debate over sugar and fat illustrates the challenges of nutritional science, highlighting the need for ongoing research and open dialogue between scientists, public health officials, and the food industry. The historical debate over sugar and fat as the primary risk factors for heart disease is emblematic of the broader challenges facing nutritional science. The interplay between research, corporate interests, and public health policies has shaped dietary recommendations and influenced consumer behavior for decades. While the legacy of this debate continues to resonate in contemporary discussions about nutrition, it underscores the importance of critically evaluating evidence and fostering a nuanced understanding of dietary impacts on health. As public awareness of the risks associated with both sugar and fat continues to evolve, the challenge remains to promote healthier eating habits grounded in robust scientific evidence. The ultimate goal should be to guide individuals toward informed dietary choices that enhance their overall well-being.